I would like to introduce Dr. Anju Usman, the Medical Director of True Health Medical Center and Pure Compounding Pharmacy in Naperville, Illinois. Today we'll be talking about behaviors, bacteria, biofilm, and the gut. Welcome, Dr. Usman.
Hi.
Thank you for being here with us today. Before we get started, I want people to maybe get an understanding of your background and maybe why you're so passionate about what you're doing.
Well, I'm a family practice physician, and I've been practicing medicine since the early 1990s. I have 4 children with some medical issues, including asthma, allergies, diabetes, arthritis, and multiple chemical sensitivities. And because my children are so sensitive, I started looking for options and treatments to help them with their medical issues and started working with children on the autism spectrum in 1997. And over the years, I have learned a ton of things in regards to the medical issues that face children with autism and various comorbid conditions that they have. And I'm extremely excited about the interface between the gut and the brain. So I like to focus on that piece for a lot of my patients.
Now, many individuals with autism have a wide range of behavioral issues. When dealing with bacteria, biofilm, and the gut, what types of behaviors are we looking for that some type of sign is wrong there?
Well, when people think about the gut or GI issues, they usually think about GI symptoms like gut pain or reflux or constipation or diarrhea. So our patients could have all those types of symptoms, or they may not have any of those symptoms and still have GI issues. And those GI issues might be manifest as various behaviors. For instance, many of our kids can't talk, or they may not express pain in the way you and I do. So when they're in pain, they may posture or press their tummy, or they may just have aggressive behavior or self-injurious behavior. Also, if their GI tract is bothering them, many of our patients may express that with anxiety or obsessive-compulsive type behaviors and repetitive behaviors. So probably the most common symptoms that may be associated with gut issues are symptoms like obsessive-compulsive behaviors, anxiety, self-injurious behaviors, and aggression.
So basically a lot of what we're dealing with in autism.
Mm-hmm. and even sometimes attention and focus can be related to what's happening in the gut.
So there really is that brain-gut connection that we hear a lot about.
Yes, exactly.
Let's talk about, bacteria. How does bacteria affect gut flora and our immune system?
Well, that's a great question, because when we think about the gut, the first thing that you guys might think about are things like the stomach and then the small intestines and the large intestines. But today we're going to focus on the microbiome. And the microbiome is the bacteria that is in our GI tract. It also refers to bacteria elsewhere in the body, like on our skin or in our eyes or in different places in our body. But for the purpose of today, we're going to focus on the microbiome or the bacteria in the GI tract. And the bacteria in the GI tract is so important. The term is gut flora as well as the microbiome. And this bacteria there's over 1 trillion bacteria in our body. There's more bacteria in our body than there are other types of cells in our body. And there's more DNA in that gut bacteria than there is DNA in our body. So the gut bacteria is extremely important to our health, in particular our immune system. If we disrupt the gut flora by killing off certain niche bacteria, or we decrease the diversity of different bacteria in our gut, or the types of different bacteria in our gut, we can affect immune function later on in life. And this can lead to things like inflammation, inflammatory bowel disease, allergies, and potentially autoimmune issues.
It seems like bacteria controls a lot of what's going on in our body.
Exactly, especially the bacteria in our gut, and especially if it's disturbed or disrupted. And so things like our moms having antibiotics while they're carrying a baby, or our moms having C-sections, or antibiotics during delivery. All of these things early on in development may disrupt the gut flora and then lead to immune issues later on in life.
And so you talked a little bit about some of the signs and symptoms of behaviors we might see when we're dealing with a whole wide range of all of this. Can you go a little bit more into depth about that? Like, what are some of the red flags that parents might see? Obviously, you talked about aggression behavior, ADHD, or attention deficit.
Right. So, again, when the gut flora is disrupted, you might see some of those behaviors that you mentioned. But kids might also end up being diagnosed with things like eczema, food allergies, food sensitivities, seasonal allergies, chronic sinusitis or chronic otitis, reflux, constipation, diarrhea, some of the GI issues that we mentioned too. So again, all these immune issues, if they start showing up in a child early on in development, early on in infancy, then we already know that the immune system has become disrupted, and we want to do things to kind of get that immune system back in balance. And one of the most important things to get that immune system back in balance is to get the gut flora or the gut microbiome back in balance.
Now, how do probiotics play a role?
Well, probiotics are a way to put back some of that homeostasis that may have been lost due to early exposure to antibiotics or poor exposure to our mom's good gut bacteria or bacteria in general. So probiotics are basically, they are good bacteria in a pill form. And the probiotics confer a health benefit to the host or to the person that's taking probiotics. The probiotics are that good bacteria. And so when we take them orally, we colonize the GI tract transiently, and this allows the other good bacteria that's there to take a better hold, and also allows the bad bacteria to be kind of released because these probiotics have an antimicrobial effect on some of the bad bacteria.
Now, there's lots of different probiotics. We hear about this often, everything from yogurt to, kefirs and different things like that. And then you go into the health food market, and there's just so many options to choose from. How do we know how to even choose a probiotic?
Well, again, probiotics being good bacteria might be found in various types of foods. And you mentioned yogurt is a good source of probiotics, as well as kefir, which is a fermented dairy product and is also a good source of probiotic. There are also fermented foods such as sauerkraut and other fermented foods that are ethnic, such as kimchi. So in terms of the foods and the food substances, taking those types of foods and consuming fermented and cultured foods is a good way of getting some of that good bacteria back in your body. But some of our patients are adverse to eating those types of foods, and many of our patients are extremely sensitive to dairy products. So we try to avoid yogurt from dairy products. Instead, maybe use yogurt that has been cultured in coconut milk. The other potential is taking probiotic supplements. And when you look at a probiotic supplement, you want to try to get at least 20 billion bacteria in a capsule. And you want to try to get a variety of different bacteria. The two most important bacteria are Lactobacillus and Bifido. And they have different types of species of Lactobacillus and Bifido. For instance, there's a species of Lactobacillus called Lactobacillus rhamnosus. And another name for that particular species is Lactobacillus GG. But they've done studies on Lactobacillus rhamnosus. And by taking that particular strain of Lactobacillus, you can help with certain receptors in the brain called GABA receptors. And those GABA receptors in the brain help with stress handling, help with anxiety, and depression. So in various studies, they find that taking probiotics, such as Lactobacillus rhamnosus, can improve depression, anxiety, and stress handling and mood, which to me is amazing to think that you take a good bacteria into your gut and it helps your brain. And that's when you realize that there is a crosstalk through a nerve in the body called the vagus nerve. There's a crosstalk between the gut and the brain. So a healthy gut really, in essence, leads to a healthy brain.
I'm listening going, wow, I think the parents out there, that are listening for their children of all ages, this information is just so valuable. So thank you so much. And as I know, they're probably writing it down just as much as I'm writing it down here, and I'm the one talking to you.
Well, there's another bacteria that I want to mention, too. It's called Lactobacillus salivarius. And the studies on that show that that particular strain of bacteria helps to modulate how you perceive pain. So patients with low levels of Lactobacillus salivarius, they may not have a strong injury, but because they don't have enough of that bacteria, they may feel it as very strong. So they may overreact to pain. And so people with chronic pain do better if they're on a probiotic that has Lactobacillus salivarius.
Now, it's because when you're talking about all of the way that bacteria plays a role in your gut and everything else, it makes sense that adding a healthy probiotic strain for this stuff could actually help kind of balance the system, as you were talking about the gut flora. Now, what are some symptoms involved with small intestines and bacteria overgrowth?
Well, what we're talking about when we're talking about good bacteria, we are also kind of talking about bad bacteria. So we want our body to have good bacteria and not be over-colonized with bad bacteria. So that imbalance between the good and the bad, the term for that is called dysbiosis. So in dysbiosis, you have too much bad bacteria growing in your gut, and certain bacteria can lead to certain types of symptoms. They find that certain species of a bacteria called Klebsiella is associated with a specific type of arthritis called ankylosing spondylitis. So what happens is your body fights the Klebsiella bacteria that shouldn't be there and inadvertently ends up fighting your own cartilage in your spine and in your back. A similar process happens with strep. Many of our children have strep overgrowth in their GI tract or in their throat or in their mucous membranes of the ear, and the body starts to try to fight that strep and inadvertently fight their own basal ganglia or their own brain cells, leading to behaviors such as obsessive compulsive behaviors or OCD and anxiety. So getting the balance of the good bacteria in your body is really important. You mentioned another condition with the small bowel. And there, in addition to dysbiosis, there is another condition called SIBO, and that stands for small intestinal bacterial overgrowth. And these are specific bacteria that overgrow in the small intestines. And when they grow in the small intestines, they produce specific gases, such as hydrogen gas or methane gas. And those gases cause various types of behaviors and various metabolic effects. SIBO is a little different than dysbiosis in the fact that SIBO really has to do with the way the gut moves, the way the gut lining moves. It's really a motility issue where the little muscle fibers that surround our intestines and allow food and fiber and stool to pass through the gut, those muscle fibers and neurons that fire those muscles are not moving the right way. And because they're not moving the right way, bacteria that shouldn't be in the small intestines kind of get stuck there and overgrows and produces these methane and hydrogen and sulfur type gases, which again can lead to pain type syndromes, can lead to what we call malabsorption of fat and maldigestion of protein. So they can also lead to health issues.
And what causes this?
Well, again, with the dysbiosis, more than likely it's caused by things in our environment such as antibiotics, the lack of diversity of bacteria now in our food, and potentially pesticides and herbicides or glyphosate called Roundup. Those types of items can lead to dysbiosis. But with the small intestinal bacterial overgrowth or the SIBO, it's a muscular issue, it's a neuronal issue where the gut isn't moving. And so the theories behind SIBO is that an initial insult, maybe from food poisoning, causing some damage to the gut, or potentially toxicity causing damage to the gut lining. Many of our children with autism also have mitochondrial issues, which cause poor muscle contraction, and they may also lead to poor motility. So it's multifactorial.
Now, what are the long-term effects?
So the long-term effects of having this overgrowth of bad bacteria or in the small intestines would be that the small intestinal gases that are produced by this bad bacteria, like the methane and the hydrogen, are toxic to the body and to the brain and inhibit further detoxification because the body's working so hard on on these things that its substrates are used up, and so then it's just harder for our body to detoxify other things. Because these bacteria are growing near the small intestines, it also affects the absorption of nutrients that should be occurring at the small intestines, especially fat-soluble vitamins and amino acids. And then the good bacteria in the small intestines help produce B vitamins such as B12 and other B vitamins. So these bacteria really disrupt our growth, our physical health, and our mental health.
Now, what are some treatments that, the families can consider to do?
So we talked about probiotics as being a good potential or treatment, or fermented foods. But some other really simple solutions are avoiding eating foods with high sugar content that can feed the bad bacteria and also bad yeast in the gut. So a very clean diet. So we don't want to add more toxicity to the system. So eating organic and GMO-free can be another valuable tool. Eating fermented foods and cultured foods. The other thing that people can do besides adding probiotics is adding digestive enzymes to help the digestive system kind of move food through and digest it better. So digestive enzymes such as plant-based enzymes or pancreatic enzymes can be very valuable for helping this bacteria. An important thing for this also is the pH of the body. We want the pH to be the right pH so that digestion can occur effectively. So eating a variety of foods such as green leafy vegetables and not just acidic foods, but more alkaline foods like the vegetables is helpful as well. And then addressing motility. We want the gut to move through. We don't want things sitting in the gut, because when we detoxify, things go through our liver and our gallbladder, end up in our bile and end up in our small intestines so they can be excreted. But if things aren't moving through there, all those toxins get reabsorbed into the body, and then the liver has to detoxify them again. And that puts a lot of stress on detoxification pathways. So addressing motility and getting things to move through the gut is really important. In our practice, we use things like vitamin C and magnesium citrate to help kind of move things through the gut quicker and with ease. And then kind of the final thing for all of this is sometimes we need to work on getting rid of the bad bacteria with antimicrobial herbs or even potentially antimicrobial drugs such as antibiotics and antifungals. And by killing the bad stuff, again, it allows the good bacteria to repopulate.
Now, when you're talking about, getting things to move, I know a lot of parents might be listening thinking, well, how often are things supposed to move? Is it every day they should have a bowel movement? I know for myself at least, when my son was diagnosed, he was having a hard time, and, a doctor that didn't really know what they were talking about said, oh, it's okay if they don't go, have a bowel movement, every day. It could just be every 5 days, every 6 days. And, what I've learned now is that's just not the truth. But, for the new parents that are listening especially, how often should a child or of any age have a bowel movement to get things to move through?
Well, at the minimum, people should have bowel movements once a day. And if you're eating a high-fiber diet, which is, very good for the growth of good bacteria in your gut, you may have bowel movements with each meal again, depending on the amount of fiber you eat with that meal. But once a day is the minimum. Some of my patients' parents tell me, well, my child has a bowel movement once a day. So I ask them to do a little trick. I ask them to feed them beets or corn. And this may sound a little gross, but if you feed them beets or corn, and you kind of watch the bowel movements to see when it comes out, it should pass within 24 hours. In fact, it should pass within 12 hours. If it takes longer than 24 hours for you to see that in the stool, then your child has a motility issue. Things are sitting in the gut way too long. And then again, as we said, that's going to put up pressure on the detoxification system. The other thing that happens when stool sits in the gut too long is food starts to ferment, and it produces these gases that I mentioned that are very toxic. The other big thing that is produced when stool sits in the gut too long is ammonia. And for many of our kids, when ammonia builds up, it causes behavior issues, especially aggression or rage. I kind of call it the high ammonia thing. A mean drunk, what a mean drunk person would look like. That's what high ammonia might look like in an individual.
Well, I think a lot of family members out there that are listening, the moms and the dads and the grandparents and some of the other professionals, I mean, I think we've all seen that with kids that are having these issues. So I think, those are great things to consider. Now, we've talked about behaviors, we've talked about bacteria. Now, let's talk biofilm. What is biofilm?
I'm surprised that more people haven't heard the term biofilm. I think that the first time I thought about it or heard about it was at my dentist's office. I saw a mouthwash, and it was called Biotine, and it said biofilm degrading mouthwash. And I looked at that, and I thought to myself, what is biofilm? And basically, it's that film that kind of grows over bacteria. You guys feel it every day in the morning when you wake up and you touch your tongue to your teeth and you feel that grit over the bacteria in your mouth. That's biofilm. But basically, it is it's a community. So think of bacteria and think of bacteria growing together in a community. And when the bacteria grows in a community, it creates a film around it, kind of like a little Atlantis or a covering to protect the bacteria from the outside world. And this covering or matrix, is made up of, basically it's a mucus. So it's made up of a little bit of sugar or saccharide, and it is also held together with calcium, magnesium, and iron, because these sugar molecules are negatively charged, and they need positively charged molecules to hold that film together. And so the positively charged molecules that hold that film together are calcium, magnesium, and iron. So this mucus surrounding the bacteria colony that's made up of polysaccharides, calcium, magnesium, and iron protect the bacteria from being destroyed by the immune system. It protects the bacteria from antibiotics. And it protects the bacteria from an adverse outside environment, such as too much salt or too much acid.
So basically, when you're thinking of biofilm, it's just basically this substance that's in you that's not supposed to be there, that's a sticky kind of, I hate to say sticky icky, but it's a sticky icky thing that's a slippery slope. Does that sound right?
That does. But there's good biofilms and there's bad biofilms. The bad bacteria produce biofilms that we consider pathogenic biofilms. And as I mentioned, these pathogens or these pathogenic biofilms are really difficult to penetrate. Antibiotics cannot get through these things. So you need 100 times a dose of an antibiotic to actually penetrate a biofilm, and that's just too toxic for us to get. So the majority of infections that we cannot get rid of, like ear infections or sinus infections or urinary tract infections or infections on various prostheses or catheters, the majority of these really difficult to treat infections are persistent because they are protected by this biofilm.
Now, what are some symptoms like for the bad?
Well, again, it would be these symptoms of chronic infection, where you have a chronic yeast infection or a chronic ear infection that's not going away. The bacteria that hide in these biofilms are really smart. They exchange genetic material. They have a crosstalk between them. They don't express certain proteins on their membranes so that the immune system, they can evade the immune system. So again, in our world, we're working with chronic infections like MRSA, methicillin-resistant Staph aureus, or chronic C. diff, Clostridia difficile, or chronic strep, or chronic Lyme, or chronic viral load. Whenever we're dealing with a chronic infection, there has to be biofilm associated with that.
It almost sounds as though it's like this magic shield that like nothing can really penetrate. So how do you?
Yeah, it is. It is exactly what it is. So I mean, it's a difficult situation, and they tend to grow in toxic environments. And I think that's why our children are faced with some of these chronic infections, because they do have this kind of underlying issue with poor detoxification, and their systems become so toxic, and then the gut becomes so toxic, and then these pathogens grow, and we just can't get a handle of them.
How do you recommend treating them?
Well, in addition to what we've talked about, like probiotics,
fermented foods
and enzymes and fermented foods, there's this concept of synbiotics, or SYN biotics. Synbiotics are a combination of probiotics and prebiotics. And prebiotics is a fancy word for soluble fiber. And the combination of the probiotics and prebiotics in various studies has been shown to break down biofilm. So just by taking probiotics and a good amount of soluble fiber, you are able to help kind of slowly degrade this biofilm. The other thing that's really simple that I recommend that can help kind of degrade the pathogenic biofilm is apple cider vinegar. Apple cider vinegar is amazing for this, and it also helps kind of balance the pH. So one of the protocols we use at the clinic is a teaspoon of apple cider vinegar and a teaspoon of honey with a quarter teaspoon of baking soda to kind of help restabilize the pH and kind of break down some of these, start to break down some of these pathogenic biofilms.
How often is that? Just once a day?
Yeah, usually we'll have patients do that once a day, first thing in the morning, if they can do that.
Oh, that's an easy thing.
That's an easy thing. But there are other things to help break down biofilms that are a little bit more intense.
Now, we talked about behaviors, bacteria, biofilm, and finally, let's talk about the gut. When talking about the gut, yeast, strep, you talked a little bit about that already, parasites, they all can be issues. Now, what are some symptoms when we're looking specifically for those things?
Well, because I've been doing this for a long time, I have kind of over the years, kind of come up with some symptoms that are associated with specific types of bacteria. And there also is a consensus between various doctors who do what I do on some of these types of bacteria and their symptoms, their specific symptoms. So I'm going to share with you some of that information. I mean, this isn't information that you're going to find in a double-blinded placebo crossover controlled study. But again, it's evidence-based, based on various like-minded clinicians. For instance, many of our patients have issues with Clostridia species overgrowth. It's not always Clostridia difficile, but other forms of Clostridia overgrowing in the system. And one of the things that Clostridia produces is an acid called Propionic Acid. And there's a researcher in Canada named Dr. Derek McFabe. And what he did was he took Propionic Acid and he injected it into rats or mice and kind of observed their behavior. And they tended to have kind of antisocial behavior, a bizarre behavior, obsessive behavior. They were irritable and agitated, all because of this propionic acid. And that's kind of the behaviors we see when we see kids who have Clostridia overgrowth. Aggression, OCD, temper, agitation, irritability, excitation, hyperactivity. Another big clue to Clostridia is extremely foul-smelling stools. The kind of stools that, you know, somebody has a bowel movement and nobody wants to go in the bathroom afterwards. Many children with Clostridia also have loose stools or diarrhea or potentially mucus in the stools. And Clostridia infections are really hard to clear. In the literature, they say using very high potency and strong strains of probiotics. For instance, I mentioned 20 billion is the minimum. Well, with Clostridia, there is a probiotics that go up to 450 billion bacteria. Yeah. Saccharomyces boulardii or good yeast can also help Clostridia. Carnitine is really helpful for Clostridia because it helps clear propionic acid. Herbs I haven't found that have been that helpful for this issue. Like I said, it's really hard to clear. So most doctors resort to antibiotics such as vancomycin or metronidazole to help with this problem. Another big issue for our kids is yeast, as you mentioned before. And yeast symptoms are symptoms such as spaciness, foggy thinking, sugar cravings, frequent diaper rash or a red anal ring, thrush, which is the kind of the white coating on the tongue. But a really big symptom that we see in a lot of our patients is that inappropriate maniacal laughter and giggling for no reason. Waking up in the middle of the night and laughing and giggling for no reason is a big one for us.
It's almost like they're earlier you talked about maybe an angry drunk. They're almost like a happy drunk.
Yes, exactly. The angry drunks and their ammonia, and the happy drunks and their yeast overgrowth.
Yes. So when people that are seeing that, they know that's a red flag.
That is a red flag.
And so what about parasites? What symptoms do we look for
parasites? So people think because we live in the U.S. that we don't have parasites, and that's a third world country issue. But so many of us have parasitic overgrowth, especially patients who are chronically ill and patients with immune issues. We're all exposed to these types of things, but patients with chronic illness or toxicity and patients with immune issues can't get rid of them. One of the most striking features of parasites is behaviors around the full moon. And that may sound bizarre, but what happens with parasites is they kind of hide deep in the tissue of our body, but they come out to reproduce and lay eggs in the gut lining around the full moon. And so right before the full moon, about 3 days before the full moon, we sometimes start seeing behaviors in our patients. And they're very bizarre behaviors. Things like sniffing, licking, biting, teeth grinding, chewing, chewing on ice in particular, picking at things, fecal smearing, insatiable appetite without gaining weight. These are probably the biggies in terms of parasite symptoms.
Now, what steps do we take to help all this stuff?
Yeah, well, like I said, I mentioned a couple things for Clostridia. For yeast, again, things like the probiotics, limiting carbs and sugar, high sugary foods in your diet can help prevent yeast from overgrowing. There's certain minerals that could help for yeast, in particular zinc and molybdenum. And then we potentially use a variety of antimicrobial herbs, such as Peau d'Arco and garlic, or oil of oregano, grapefruit seed extract is another one that's good for yeast. In our practice, we also use some homeopathy for yeast issues. And then if we have to, we can use pharmaceutical agents, such as nystatin or fluconazole or diflucan.
And then what about for strep?
For strep, the herbs I tend to use for strep, and the symptoms of strep might be a little different than yeast and parasites. With strep, we'll see more of that ritualistic or repetitive, obsessive, compulsive type behaviors, maybe verbal tics or verbal stims. So when we see those types of symptoms, I really want to rule out strep and rule out something like pandas or PANS. But in terms of treating that with herbs, some of my favorite herbs for strep would be the berberine type herbs like golden seal, barberry root, Oregon grape root, and neem. And then if that doesn't work, then using antibiotics such as various types of penicillins or amoxicillin or zithromax.
And then with parasites, you were talking about when they're coming out. So let's say it's a full moon, and all of a sudden we start noticing, some of the behaviors you were talking about. Is there something natural that we could try, or is there, is there something that you recommend right away before they can maybe get into a doctor to get tested?
Yeah. So the problem with parasites is because they're hiding in the tissues, they don't often show up in the stool. So if you're going to do a stool test for parasites, make sure you do it around the full moon.
Okay.
Then you'll have your best chance of finding something. And you might want to do a provocative agent, like give them something to kind of provoke the parasites to maybe show up in the stool. Some of the natural remedies for stool, for parasites are products such as pumpkin seeds and clove oil and black walnut. And then we use those as treatments as well, like black walnut and clove. Clove oil is very strong, though, so it's very hard to take orally. Another natural remedy for parasites would be an herb called wormwood. And that makes sense because it's called wormwood. And then oftentimes we have to resort to antiparasitic drugs. And my favorite drugs to use for parasites are drugs that are not absorbed, that just work in the gut lining, such as mebendazole or parental pamoate. Another really neat thing to try if you suspect you have parasites, and we usually recommend this for parents to try on themselves instead of giving it to their children. It's called a Parasite Bomb. And with the Parasite Bomb, B-O-M-B, what you do is you take about a couple tablespoons of castor oil and a couple tablespoons of brandy. And you drink that
Now I understand why you asked the parents to take it.
Yes. You take that at 2 a.m. on the night of the full moon, and you see what happens the next day. If you don't believe you have parasites, you will believe it after you do that.
And if you don't have parasites, does nothing happen?
If you don't have parasites, then you'll be fine.
Okay, you just have a weird cocktail, but if you do have parasites,
yes, then you just have a weird cocktail. Yeah.
No,
but we don't recommend that for the children. But
I totally understand why.
On the night of the full moon, what you'll find with the parasite issues is that the children are uncomfortable, so they're not sleeping during that time. And if we give them a little bit of castor oil at night, it helps them to kind of slide out the parasites, past the parasites, and sleep better.
Yeah, that's a good tip. Now, how do we help with these issues to make sure they don't happen? Is there anything we can do to kind of get, not even be in maintenance, but like how do we prevent it? Is it preventable?
In terms of the dysbiosis and the SIBO and the bacteria, yeah, I mean, again, it all comes down to good nutrition and healthy eating and eating cultured and fermented foods, avoiding things that are going to kill our microbiome. So avoiding that whole too many antimicrobials. I mean, we really don't want to do antimicrobial soaps and antimicrobial detergent and antimicrobial hand wash at every second. We really want to get out there and actually get dirty, play in the dirt, expose ourselves to good bacteria when we can. And, for our children, we want our microbiome to be really good before we have them. So to kind of take care of these things and limit our intake of sugar and refined carbohydrates that would feed the bacteria.
I feel like both parents and children, both parents and we learn not just for our children, we learn for the parents as well, is what I was trying to say.
Exactly.
I think it's so important that we take care of ourselves too, because often we forget to do that. We're so focused on our child that, we forget, hey, what about me? And if we start to feel run down or we start to get any of these types of issues and we're not treating ourselves, then we're not at our best to help our children. So I think a lot of things you talked about, actually everything you talked about, I think could cross over not just, like as I said, with the children, but also with the moms and dads out there.
Exactly, because if our children have these immune issues, then we're not far. We're going to have them too, maybe as we age. And as a preventative thing to prevent us from developing autoimmune or immune issues, it's important for us to follow the same types of things that we ask our kids to do.
Now, if people want to learn more about your work, and how do they find you? I mean, we barely touch the surface and all the things you talk about and all the knowledge that you have. So if people are listening and they want to find out, how do I find her? How do I meet with her? How do they get to you?
Well, they could call our office in Naperville, Illinois. Our phone number is 630-995-4242. Or they can go online and go to the www.truehealthmedical.com or www.purecompoundingpharmacy.com and check out our website and what we do at the clinic as well.
That's wonderful. Now, I can't believe our hour is almost up here. I want you to be able to at least have one more thought to the families out there. What's one thing you want to leave them with that you really want them to kind of take away?
I think I said it before, but it is really true that if you have a healthy gut, you're going to have a healthy brain. And whatever you can do in your power, from your cleaning up your environment, cleaning up your diet, cleaning up the gut, cleaning up your toxicity, whatever you can do to help your gut health will help your overall well-being and potentially prevent you from developing a chronic inflammatory condition.
Absolutely. That is great advice. Prevention, prevention, prevention. And you listed so many wonderful things that people can look into to be able to treat things. So thank you so very much today for giving us this time and for all your knowledge. Truly appreciate it.
You're welcome. Thank you very much to you, Kristen, and Autism Hope Alliance for providing this avenue for parents to learn and to educate themselves and help their kids, hopefully.
Absolutely. I think it's all about us all trying to help each other, right?
Yes. I always say we're in the same boat together.
Absolutely. And thank you guys for listening. And you guys know how to reach Dr. Usman. And thanks again, Dr. Usman.
You're welcome.